I would be grateful if you would give me notice of my last 2 minutes. Minister, I don't know if there's any truth to the rumour that it's not a scurrilous one, that you somersault in celebration down the ministerial corridor on a daily basis. You being the main benefactor of the mess of Irish water. And that's a mess that has been delivered by your own party and those limping with you in government. And what you have successfully managed to do, Minister, and I know behind it all you agree with me on this, what you've managed to do is distract the public and the media from the mess that you are covering up in the public health service. And it's a mess. Now, I know you're recently, well, you know, you were on a different brief. I know that, but I would say to you, Minister, that, you know, while the public are consumed with the crisis in Irish water, and your own department is failing to address the concerns that have been highlighted here this evening, Minister, you're going to have to up your game here and start addressing this. You just can't cruise into the next general election hoping that you are not going to be held accountable for what's going on in the health service. Now, Minister, on Monday, I, like yourself, am prone to Googling. And I Googled Mr. Leo Varadkar and Irish water. And since the beginning of this month, you come up with comments on 30 separate occasions on Irish water. And when I put in Mr. Leo Varadkar and the Fair Deal scheme, you come up 4 times. That's what's going on here, Minister. You are deliberately stoking up a distraction from the mess. Yeah, you are. And I know it's not any confidence that you have in the Minister for Environment, Alan Kelly. I'm sure he's shaking in his boots tonight, because you clearly don't give a damn about the crisis in our nursing home system. You don't. You are more concerned about flagging up the debate and sticking your nose into a debate and absenting yourself from addressing the situation that has been highlighted here tonight. I suppose, Minister, you see, I see the real distraction. And the real distraction is the demise of your own political party and the opportunity you have to take out Enda Kenny as leader. That's what's going on here. That's why you're out in Irish water. Because you certainly don't want to talk about health. You certainly do not want to talk about vulnerable old people who are carrying a burden about your inactivity in addressing the whole spirit of the Fair Deal scheme. And Minister, just to bring you into some Cabinet collective responsibility, the waiting list that you are responsible for, the ones that you deny exist, the ones that were recently published, you denied that they were stoked up and fiddled. The documents you sit on, the direction to cover up and smuggle the waiting lists, that's what you're at. Camouflaging the disaster, that's what's going on, because as Deputy Collins said, we're meeting the consequences of the camouflage system. Minister, you're a GP, I understand, and it's an area that's suffering greatly. And as a Deputy from rural Ireland, I'd ask you to pay some immediate attention to the crisis that's emerging with the exodus of GPs in this country. But I think that pales into insignificance relative to the loss of our young nurses who have gone through a qualification system in Ireland, to the cost to the Exchequer. But, of course, not that you're responsible, you weren't at Cabinet the day that you gave them the yellow pack deal. And that's why Irish nurses won't stay within the system, and it's causing a crisis. They're voting with their feet and they're going to work in England after the Exchequer takes the liability and costs of training invaluable frontline staff. And Minister, the motion here concerns tonight a part of the health service that you only spoke about since the beginning of this month 4 times. But you spoke 30 times. You're on your iPad there, you can qualify whether I'm correct or not. It's probably greater because my research was effective till Monday. And I'd say you've spoken more times on Irish water in the last 48 hours than you have about the Fair Deal scheme. And that's what you care about elderly people in this country. That's what's going on here, Minister. And you and your government originally committed to a review. You smirk, but you're not smirking at me. I know you have disdain for people like me. But I have a mandate to be here to say what I'm saying to you, because I'm saying this on behalf of people who are stuck with the liabilities that you are ignoring. That's what you're doing. You can smirk all you want. I know it comes natural, but I have a mandate to say what I'm saying to you. Yeah, there you go for the water again. You have an unwillingness You have an unwillingness to deal with the reality of the situation. Unlike your great leader who wants to let Paddy know. You've got to let Paddy know. But you know, you're failing to inform yourself of the scale of the situation, because I know you as a decent person, and if you have this information like we have it, then you must find it very difficult to put your head on the pillow at night. When people are being early discharged out of hospitals, where wards are being closed as a consequence of budgetary restrictions, and you're precipitating the accelerated discharge of vulnerable and sick people who don't know their rights, and they find themselves in a broken care pattern where their children have emigrated as a consequence of our austerity, yours and mine, where you have slashed home helps, where you have broken the carers' arrangement, and yet you deny the problem here. Minister, in July of this year, the department advised your friend, your previous minister, the one that I said to you on Tuesday, you shifted the blame onto him. This mess. You were advised about the budgetary shortfall, and you've done nothing. That's your legacy so far. Your legacy so far as Minister for Health for this month is that you've spoken 30 times on Irish Water, and you have done nothing, for senior citizens or their domestic circumstances. So you can smirk at me and lie behind that ideology where somebody has to go and pay €1,000 a week because of an administrative, a deliberate strategy. You see, Minister, I have somebody in the department who rang me to tell me what really is going on.
Thank you.
And this is an administrative decision directly from you to tell them to slow it down. It's true, Minister. You have fingerprints. You are the author of this decision. Go to the...
You're over time. Thank you.
No, the only person that's over time is that gentleman across there.
Excuse me.
Yeah. Go and take up the glass of water. Go on to Facebook, will you?
Sorry, we switch off the microphone, please. Sit down and behave yourself. Deputy Smith, thank you. Will you sit down and behave yourself and speak through the chair in future? Thank you, Deputy Smith.